My name is Robert Henry. I am a student currently at Colorado Christian University in a bachelor's program for healthcare administration and enrolled in managing healthcare human resources taught by Charlotte Mather. This presentation is an interview discussing employment laws and healthcare reform. The interview was with Mr. James Mather, a senior human resource specialist with more than 10 years experience. He works with the Readjustment Counseling Service for the U.S. Department of Veteran Affairs and serves as the Human Resource Specialist for an estimated 2,800 employees nationwide and an estimated 30,000 patients. In the interview, we discussed employment law and healthcare reform and covered specifically Title VII of the Civil Rights Act of 1964 in relation to discrimination and diversity, then sexual harassment and the hashtag #MeToo movement. We then discussed the Affordable Care Act and the impact it has had on the Veteran Affairs. Before discussing the interview, I want to do a quick review of the Employment Law Title VII Civil Rights Act of 1964. This prohibits employers from discriminating against employees on the basis of sex, race, color, national origin, and religion, and forbids in any aspect of employment discrimination. The U.S. Department of Health and Human Services conducted research into the diversity of the health workforce from 2011 to 2015, releasing the information in August of 2017. Of notice, the report states the results demonstrate there is little balance in terms of the sex of an individual in the health workforce when there are proportionately more females in 25 of the 30 occupations. However, there is a considerable variation in race and ethnical diversity by occupational groups. On the graph, I selected to highlight only 3 of the 30 professions from the report, which are what I believe to be the most common professions that we will work with in the healthcare field. As you see, even with employment laws preventing discrimination and providing equal opportunity, the majority of these professions show little diversity. After discussing this information with Mr. Mather, I asked, how does Title VII of the Civil Rights Act impact your organization in the recruitment and hiring of personnel? Mr. Mather responded that the system works because the Veteran Affairs is a federal entity, and he discussed some of the policies and procedures in place to prevent the discrimination of any individual applying for positions within the Department of Veteran Affairs. When asked about the diversity within the Veteran Affairs, his response was that he felt it was highly diverse, and that in his office alone, females accounted for around 70% of the workforce, and that only 8% were a minority. These statistics closely match the statistics reported by Health and Human Services. I then discussed with him the press release from the Equal Opportunity Council, EEOC, which was impacted by hashtag #MeToo movement and stated they would be taking a greater look into workplace harassment and efforts to change the workplace culture, hold people accountable, and have the right policies, procedures, and training. After hits on their website more than doubled after the start of the hashtag #MeToo movement, the EEOC went so far as establishing a select task force on the study of harassment in the workplace. I then posed the question to Mr. Mather, with the hashtag #MeToo movement gaining the attention of the EEOC, what impacts has that made to your company's sexual harassment policies, procedures, and training? He responded that the impact had been very positive and relayed that there had been a cultural shift in the workplace to greater unacceptance of sexual harassment. He expressed to me that the hashtag #MeToo movement and the EEOC efforts have created positive effects by getting individuals to come forward armed with the knowledge that society and legal systems will support the victims and hold the violators responsible. Before moving on to the next article and interview question, here's a quick review of the Affordable Care Act. Signed into law by then President Obama on March 23rd, 2010, as you see, the ACA was intended to expand access to insurance for over 32 million people and curb the rising cost of healthcare, as well as the other provisions listed. What I discussed with Mr. Mather was the New England Journal of Medicine article that states that healthcare reform should rest with state legislation. In the survey that they reported on, it is clear that the bipartisanship in Congress is stalling healthcare reform, and pointed to Medicaid expansion being the answer in most states. Not surprisingly, the belief that policymakers should improve access to healthcare to both insurance and providers, and there needs to be a more unified effort to standardize healthcare costs. I asked Mr. Mather, with the ACA becoming law, how has that impacted your organization? He responded by discussing the Choice Act, which is being enacted and worked on, and how that has enabled veterans to seek health care outside of Veterans Affairs if needed. In contrast to what the ACA provisions set forth to do, Mr. Mather explained that this is causing problems by the Veterans Affairs losing money that is going to the private sector, and how the reimbursement for seeing veterans was cumbersome and costing the private sector millions of dollars, which in turn impacts the ability of veterans to access care in the public sector. In conclusion, I would like to thank Mr. Mather for his knowledge, time, and willingness to assist, and express my gratitude for what he does for the veterans of this nation. By conducting this interview, I was able to validate that there still exists a clear absence of diversity in the healthcare organization, that the hashtag #MeToo movement was successful in bringing the problem of sexual harassment to the forefront of workplace concerns, and that the bipartisanship in Congress is preventing the reform of the Affordable Care Act into something that actually expands the access to health care and curbs the rising cost of health care. When I consider the problems we face with healthcare reform, I am reminded of the words of Christ in Matthew 10:42. Whoever gives one of these little ones even a cup of water because he is a disciple, truly I say to you, he will by no means lose his reward. Since we are all children of God, regardless of race, sex, ethnicity, and religion, should we not be willing to care for his most precious creation, and in doing so becomes the hands and feet of God by answering the prayers of so many? If our leaders in the workforce and government would sit down with that thought in mind, think of what we might accomplish.